Innovative.
Dynamic.
Gritty.
Determined.
Warrior.
This podcast is about the innovators,
the leaders on the front lines of adversity,
the all-around good people doing good deeds.
They are the civic warriors of the world. Our guests are the leaders in the nonprofit industry affecting change.
They try, they fail, they overcome.
Through their stories, we can join forces to become civic warriors.
Welcome, friends. So today, we are going to talk about homelessness in the not-for-profit world. We're joined today by Eileen O'Donnell, who is the Executive Director of Coming Home of Middlesex County. I also have a small conflict of interest because I'm the board chair of Coming Home of Middlesex County. The reason we brought Eileen on today is because we are doing a lot of innovative things. We are helping to solve the homelessness issue that exists in the world in a lot of different ways in our county itself. And Eileen has been the catalyst for that for the county and a catalyst for that in the homeless community and in the not-for-profit community, specifically around this issue. So welcome, Eileen.
Thank you.
So I figured just for our friends who are listening out there, why don't we give them a little background about Coming Home? You know, just spend a little bit and just say, what's our mission and how did we get here?
Okay. So Coming Home is a little bit of a strange not-for-profit because not-for-profits are usually formed by a group of interested private people who want to take care of, for example, their developmentally disabled children because they know they won't be around for a long time. And then they form a nonprofit and everybody contributes and they have their mission. But Coming Home was formed by the Middlesex County. So it's a government agency saying, I think we should have a nonprofit to implement our plan to end homelessness that all counties in the country were required to develop around circa 2008, 2010, around there, in order to get money from HUD, the Housing and Urban Development Agency of the federal government. And so the Middlesex County developed their plan with input from a lot of stakeholders and then said, okay, now how do we spearhead the implementation of this plan? We could hire a handful of people on our staff, or we could create a nonprofit, because perhaps a nonprofit is more facile in public bidding. They don't have to go according to the government rules for government bidding. They will be able to form public-private partnerships more easily than we will. They don't have all those government regulations to deal with, and they'll be able to bring in private monies, perhaps. The mistaken idea that the county's founders had was that they were going to start this with a minimum contribution of $50,000. And there would be $50,000 actually from the Robert Johnson Foundation, from the United Way of Central Jersey. And that then they hired an executive director, which was my predecessor, and then they would be done. And they would go.
Nonprofits are self-sustaining. You don't need funding.
Yeah, and they would go away. They figured, okay, then the private sector will completely take over, and they'll be out of it. They'll go away. But that doesn't happen.
No.
Right? Because private funding comes in, but private funding very rarely is for your operations.
Very rarely. It's mostly for a project, program, or initiative.
Right.
Especially, an innovative initiative. So
right.
About all the time it takes to create that.
Right. They
on top of just what they fund you for.
Right. Yeah. They don't want to pay your salary.
No.
They want to feed a family, house a family, clothe a family, things like that.
They want to further their impact, which is what they're incorporated to do. And
right.
so
and they want to be able to point to something.
100%.
Not to your operations, not to your overhead.
No.
We pay their electricity. Yes. Yeah. No.
Keep the light on for you.
Yeah. It's an interesting mission for Coming Home, because the mission of Coming Home was to create a system to end homelessness, was to get everybody to work together. Everybody, all the stakeholders in the county, the shelters, the food, the soup kitchens, the food pantries, the affordable housing developers, get everybody to work together, which makes for a horrible elevator speech for funding. You want to say like, oh, I'm the soup kitchen and I give 2 meals a day to people who are hungry, and so like, well, I'm creating a system. That person pushes floor 2 and they're out.
Right. And that has been one of our most significant challenges just from the fundraising aspect is, well, like, what do you do on paper? Yeah. And it's like, it's a little more challenging than that. Yeah. But when people really understand what we do behind the scenes, not on paper, you start understanding the value of having a not-for-profit that can partner with agencies.
Exactly.
I mean, at the end of the day, the nonprofit world, I work with a lot of clients there. It's hardly inefficient with spending in certain regards, because you could have 5 agencies doing the same thing, and then each one has their own overhead structure.
Exactly.
Where if they all didn't have that overhead structure, more money would go towards a particular cause, and you'd still have people being paid like a reasonable wage.
Right.
And that's where I think, I want to talk about today a little bit is the whole partnership aspect. Like, how do we maximize our impact on not coming home, but the issue we're trying to solve? Ignore coming home altogether. At least that's how I view it. What are we trying to solve, and how do we get there?
So more importantly than economies of scale and efficiencies in agencies,
right.
It was for the homeless person, right?
Exactly.
So before and we're having a lot of success in creating a system, but before that, the help the homeless person got was fortuitous. It depended on whose doorstep they landed or who they might know. So if they happen to know somebody from Catholic Charities, or they landed at Elijah's Promise, or then they would get certain help. And everybody, for example, had their own list of people that they were the clients, if they had limited resources, how they were going to help them. And so the idea was, just like Doctors Without Borders, to have agencies without walls. And so let's do everything in a coordinated fashion so we don't duplicate things. We're more efficient. That was the idea. So we started out, and it was helpful in the beginning that we wanted to change our homeless management information system. So that's the acronym is HIMIS. So in New Jersey, the HMFA, the state agency, was doing HIMIS for everybody except Bergen County, because they're Bergen County. And so, and they were doing it for everybody, including us, but people here were not quite happy with the software provider they were using, because they wanted it to be an open system, and they wanted it to be client-based, not agency-based, so that the homeless person didn't have to repeat their information everywhere they went for help, and that we could collaborate and coordinate. We went out and researched and found when I say we, I mean the collective we, not Coming Home, because it's all the agencies that were working together to end homelessness, and researched other software providers and found Bowman, which has been renamed multiple times since then through its corporate iterations, and it was client-based, and it could be open. And so when you have something like that around which everybody needs to coalesce, because you need to learn the system, get trained on it and that sort of thing, it brings everybody together. So it was a natural vehicle. It's like we cheated, but it was great that it came in right then and there.
100%. Yeah.
So people started thinking system-wide. So we wanted to use the information not just for reporting, which, to our funders, which had been used before, but we wanted to use it for planning and operationally. So we all started talking about that sort of thing. And that brought us together. And that was in 2012. And that's sort of thinking along those lines. And then by the beginning of 2015, the end of 2014, well, actually, we did something in 2013, which is really cool too. But let's get back to the stakeholders. They said, let's implement a coordinated assessment system. Again, this was a government regulation. Sometimes government regulations can be onerous, and dealing with regulators can be pain, but they've some really great ideas, and they allow you the flexibility to implement it the way you want to implement it. And so it took a year of planning for all the stakeholders to get together and the idea is to have a single point of entry for a homeless person. And it could be virtual, which for us it is. It's by calling 211, and then have a uniform assessment tool and agreed upon criteria to prioritize the persons on that list. So it took a year of planning to agree to that and testing different models. And so by the end of 2015, we implemented our coordinated assessment system. And that really has brought the community together and working together. So it's really cool.
Yeah, and I think the bigger picture there that I think a lot of people don't consider, which I love that, we kind of were the catalyst for it in a regard, was, how do you take away the agency only look, and how do you put it into the hands of this is the system? Like, because it's a system, and there's a start and a finish to all of this. You've identified an issue, and then there's an end goal. And that end goal is never one agency that can accomplish that. There's no one agency that can provide, maybe there is, but I don't know them, that can provide housing well, case management well, identification of the people well, data management well, doing everything else that you do, providing food, providing transportation. There's a lot of things that have to happen to help someone actually solve the root of whatever the issue may be. It's not just homelessness. It's always something more than homelessness, and that's something Eileen always kind of talked to us at the board level. And it dawned on me. There's a lot more healthcare aspect to homelessness than there is actual no roof over your head. But the data management part, I think, is a big thing, because collecting that data, analyzing it, and then making decisions based on quantifiable data helps you really provide a better result. It helps you get to the end quicker and better. You know, okay, these individuals are chronically homeless. These individuals are temporarily, but no one even knows who these people are because maybe a single mother working a job, they lost their job and now they have nowhere to go. We know who they are now. You know, they have an avenue that they can get into the system. We can understand and help them.
And even more importantly, so every year the HUD requires everybody to do a point in time count, it's called, but it's not a count, right? Because but what good does that do you? To go around and count people, right? But it's a survey.
It's a survey.
And then we do an analysis of the answers to that survey because you need to know who these people are and why they're walking around. Otherwise, you can't really gear your interventions to reality. You can't do that. And even more importantly is, you know, your single mother who lost a job, according to federal regulations, if she was sleeping on her neighbor's couch, which is clearly a temporary situation, she wouldn't be counted as homeless. You know, if she were on the street or if she was paid for to sleep in a hotel by an agency, she would be counted as homeless. But if she was paying for that hotel room with her and her 3 kids, for example, she wouldn't be counted as homeless because she really just wants to stay in a hotel room with her 3 kids. You know, so,
and so think about that, right? So you would never in the public know of that issue. Right. But that's a really core issue. That's someone that wants help. That's someone that really desires to improve on their personal situation. Right. And there's no government funding that exists for that particular cause or purpose. Right. Other than, you know, private nonprofit dollars or for family and friends, aka sleeping with other family, you know, on the couch with some other family.
We call those people precariously housed, and we do count them and analyze them because, you know, not to speak derogatorily, but that's the low-hanging fruit. Maybe you can help those people more quickly. Right. But they do have some resources, personal resources of their own that maybe you can get them into stable housing and to their particular level of self-sufficiency quicker than you can somebody who has a drug addiction and has been on the streets for like 3 years.
And when you're looking at these temporarily homeless, do you find that they're using, so you have this whole coalition of organizations, do you find that those are the constituents that are usually using these services more often than the permanently homeless? Have you looked at the numbers that way to see? And
we have, and so we have outreach teams because a lot of the people who are chronically homeless, and as Brad mentioned, it's a term of art. It basically means long-term homelessness. There's like a 3-year, can add up to a year, it can be different episodes, things like that. But anyway, it's basically long-term homeless. And a lot of them have untreated addictions or untreated mental illness, and they don't want to be reached quite yet. You know, so we have outreach teams and we have now more case conferencing and more collaboration around particular individuals. We've been having some success there, but you can only help people who want to be helped. You know, so they're not using services. You know, the other people would be using services that are offered them. Yeah, but they're not using services. But, you know, it's called progressive engagement. You're going to keep trying. You're going to keep trying because there's a philosophy called housing first, right? It was started by a professor up in Columbia. And I actually just heard it on the news on NPR the other day.
Oh, really?
Yeah, they started talking about it, and it's like...
You're like, I've been talking about this for 5 years.
I'm like, yes, it's been proven to be successful. And it's like, yes, sort of. So, sort of, and it goes around money, right? So it was started by Sam Semberes, who was a Columbia professor, and he was working with the persistent and severely and persistently mentally ill. And he said, listen, it's so much easier to get them services and get them help, you know, if they're homeless, once they have an address, once they have a roof over their heads. So let's do housing first, and then let's hook them up to other services in the community. Because you'll get a Middlesex County community needs assessment, and you'll see lots of people who have roofs over their head who access mental health services and addiction services because we don't have to be perfect to have a roof over your head, right? So that all makes a lot of sense. And so we want to do that for everybody, not just the mentally ill. And it's harder than for the mentally ill. And that's probably not intuitive to people. They're like, wow, why would it be harder? Because there's no money. So for like people who are mentally ill, there's often vouchers from a state government or a federal government. And so when you put that person into the housing, there's somebody to pay the rent while you're helping them get connected. And maybe there's somebody also to pay for your case management connecting services, right? While they're getting to their level of self-sufficiency. But with people who don't have government assistance, you get them into housing first. Who's paying the rent? And who's paying for your services while you're going around helping them connect to the needed services? Yeah,
while you may or may not have a job. And it's hard to get a job without a permanent residence or without...
Right. You were homeless for a reason. So there's things that need to be addressed before you're like up to where you want to be. Yeah. You know, which is perhaps job ready. Yeah.
Yeah, I know a lot of agencies that are kind of, I think definitely moving in that direction of, okay, not only do we have to offer the, services to help you get well or the services to help you find the next step, we actually want to have you have an avenue for the next step, whether that's on top of us providing case management, we have a job training program. We actually bought a facility, and this is where we do X, Y, and Z, and we have a contract with people that can hire you. That's even the further step, I think.
Which I would love to see.
Absolutely.
And we're working more and more with the county One Stop and Workforce Development to see what we can do there, and they've been really receptive, recently.
Right.
So we're trying to get some things on there. They do something really cool up in Newark, in Covenant House, for example. They have an entrepreneurial board of local business owners, and they meet once a month. They do little apprenticeships, and they take people in and then end up hiring them.
Oh, awesome.
And so I am careful not to step on people's toes. And so, for example, the Workforce Development has this apprenticeship program, but it's rather complex and it's taking a while to roll out. So I might revisit that entrepreneurial board idea. But one thing more I wanted to say about Housing First, because we started talking about progressive engagement, is even if you do find something to pay rent and you put somebody into a house and say they do have an addiction, it is not a prerequisite that they stop using before they get into their house. That's the whole Housing First philosophy. But they do have to, of course, abide by the terms of their lease or they'll get kicked out. So, nothing illegal can be done on premises. Then if you're shooting up, you cannot shoot up at the house, right?
Yeah, no smoking pot under this roof.
Yeah, but if you do shoot up and you come home and then just fall asleep, your health is really not your landlord's business as long as you're not violating the terms of the lease and as long as you're not ruining.
You're not breaking the rules.
You're not breaking the rules.
Yeah.
However, that doesn't mean your job is done. Like, okay, fine, you're in there, Housing First. No. So you have to respect their free will and their, self-determination, but you're not going to stop progressively engage. Like, go out and see if they want to go get coffee. And if that doesn't work, next week, try tea.
Yeah, but it's an interesting concept too. Just a little bit off tangent, but I'm reading a book right now about hope, right? So if you're depressed, like, how do you find hope in anything? And they said, like, one of the main things in finding hope is finding a community to be a part of. And so I think that's here too, like providing like community-based housing. I know some of our recent projects have been community-based housing. It also helps in an aspect because now you're around other people in similar situations. And if people really get the message, like, okay, like, we can all work together and actually improve our all lives together. And, that person's doing well, I want to do well like them. Or, that's why you can't have drugs in a house like that. Would not work well.
That's always a push-pull too, sort of, you want, like, Zebra Way is a nice community of people.
Yep.
But then there's regulations because it makes sense as, at least cerebrally, from state policymakers to say, no, we don't want you to have more than 25% of persons who had been homeless to be in one area because they want to make sure you're not isolating, right? It's like that's where all the previously homeless people live. So they want to make sure that you're integrating into the community. So there's competing goals there, right?
Yep.
Sometimes if somebody's been on the street for 3 years and then gets his own apartment, you think, yo, great. And he's like, I am so disoriented. I don't want to be here, right? Yeah. So there's
human beings by nature are competitive. That's an aspect of it.
Is that right, Brad?
It's absolutely right. It's been proven for the last 10,000 years. So, but super interesting concept, and I know, kind of segueing into our, the other things that Coming Home has done. And one of the things that since I've been here, we got heavily involved with is just the SHI program. I know wanted to talk a little bit about that and just maybe less about the financial details, but more about how did it get to where it is and what are we trying to accomplish with it and why is it working or why, how did it get
that
to
remains to be seen.
Yeah.
It all depends on your definition of working. We have from the beginning, from 2013, sort of started calling our fundraising campaigns "Housing is Healthcare" because, come on, it's not just all about eating non-genetically modified foods. It's about having a kitchen to cook any foods in, let alone have a roof over your head. So back in 2013, we started doing a campaign, Housing is Healthcare, sort of model. We sort of stole it from New York State because New York State was very cool at the time under that Commissioner of Health. They were actually using their state side of the Medicaid dollars, which were under their control, for bricks and mortar for homeless persons.
Oh, wow. Yeah.
That was very cool. So I sort of did, Housing is Healthcare New Jersey style and just tried to get some people to fund me. And they were like, no, No, this is even healthcare foundations, because this was 2013.
Yeah.
And they're like, yeah, that doesn't fit into our mantra. And I'm like, really? is that right? But now so fast forward to 2015, 2016, maybe 2016. And everybody's talking
And
about
this is the interesting part.
Yeah. And everybody,
years later, now
everybody's talking
yeah.
about the social determinants of health.
Right.
And it's like, so I'm actually, my background is in healthcare law. So I've been in healthcare policy and healthcare law for longer than I'd like to admit. We'd always been talking about access to healthcare, and by access, everybody meant insurance. And then we sort of presume, although not completely accurately, that we've solved that issue through the Affordable Care Act. Now everybody has access. So now what's the next great thing in healthcare? And everybody all at the same time sort of landed in 2016 on social determinants of health. And it's like, welcome to the party.
Yeah.
It's like, really, it's like, I'm glad you're here. That's the healthcare sector. Social sector always knew this, right? Actually, in 2016, CMS, Center for Medicaid and Medicare Services, put out an RFQ to the country and said, you've got social services operating in one lane and healthcare operating in the other lane, and different funders, different rules, different, but they often treat the same people, but there's no bridge. And so communities, we want you to create an accountable health community where there's a bridge. That was another very cool thing that government did. So instead of they didn't say healthcare, you should do social services, and social services, you should do healthcare. They said, keep doing what you're doing, but bridge your two sectors so that you're treating the whole person and reducing unnecessary healthcare cost and improving healthcare outcomes, right? Knowing that the country was very different at the time, and it was an election year, so we all know how different it was. They said, you guys come up with a model to do that. So we started doing that here in Middlesex County. We got the hospitals and the FQHCs and the insurance companies and the school of social work and the medical school, and we got everybody together and said, let's do something. And so we applied, and in 2016, and it took the federal government a year to say you didn't get it. But our group nonetheless said, so what? Let's do something anyway, because look, we got everybody around the table. Sure. So let's do something anyway. So it took us another year to figure out what to do, because we still thought we had to, it was a research project. We had to go to IRBs and all this. And finally, we had a friend of mine who was also the acting commissioner of the Department of Human Services at the time said, it's not a research project, stop. It's an implement. It's been studied up the wazoo and it's shown. So just implement it. So we have a program, 2-year pilot program now, whereby Coming Home has 2 case managers that are devoted to addressing the social determinants of health, such as homelessness, food insecurity, your interaction with your personal network. And that's about it. We really can't hit transportation because we don't have resources to help transportation, but it's a huge need. Of the two of the high utilizers of the 2 area, the acute care hospitals, emergency departments. So we are 9 months in, 8 months in, and we're just now looking at the cost savings. So funny you should say that. So we have actually, and then we got 25 vouchers from the Department of Community Affairs for this project as well. And that's huge. Wow. That's huge. Yeah, that's a huge contribution.
And that's kind of what Eileen was talking about before about, how do we help in different aspects, but getting state vouchers to fund housing is a
because it's
significant burden off your shoulders. Because now it's not fundraising dollars on a dollar. It's state dollars that are subsidizing housing, which is fantastic.
Which was amazing.
Yeah. Yep.
And because we had such a good reputation for having created the system and been able to lease up vouchers beforehand, so good begets good. So we were efficient, because we did the hard work, that we did the infrastructure work, that we were able to use state vouchers that had been given out to the state before, according to their very quick lease up guidelines. And so they're like, okay, we had a good reputation. And so we earned that. Yeah. And then they gave us this. So we have been able to use 11 of those 25 vouchers so far. So we are helping people. Are we necessarily reducing dollars to the ER? That remains to be seen. We just have a preliminary report this morning from one of the hospitals. I haven't even opened it yet. Bob, and my staff person, has, and says it doesn't look good from a money standpoint, but because there's this, and this that needs to be tweaked. All right, let's tweak it. So right. A lot of those people are very, very sick. And do they have a social need? I'm not sure. And if it's medical case managing you need, it's not us. It's you, to make sure that they're taking their medicine, that they're going to their primary care doc instead of going to the ER and things like that. But that's not, we don't mean to do what you do.
But that's where
we mean to do what
but
we
that's
do.
the partnership aspect. I think you're starting to see a lot more. You're clearly seeing it in the healthcare world. You're seeing consolidation left and right in healthcare, but in the nonprofit world, you haven't seen as much consolidation or as much partnership as probably you would like to solve this issue, right? So exactly that. Well, this isn't our wheelhouse. We don't do this.
Right.
They do. This is my best friend. Go talk to them.
Yeah.
Here's the contact information.
Right.
Let me know once you talk to them so that we can continue to help you.
Right.
And now that little conversation has just saved somebody's life or has furthered somebody's
right. So we're having success from that point of view, but in order to keep the program funded by the acute care hospitals, then we're going to have to be able to appease the hospitals from a financial perspective, because the people that we work with are very happy actually, because they're getting so much help with their patient management, but they're saying we need to impress the higher ups, and because they're the ones that are going to be deciding whether or not.
Of course.
So we got to work on that. We got to work on a way to present.
Yeah. So I see multiple levels of challenges. So you're bringing everybody in. So I would love to hear, I don't know at what point you came in, but bringing everyone on board to kind of buy into this. I know you said it took a while for, the country to kind of see it, but what were some of the challenges, that you experienced getting everyone on board and then implementing this? Because I'm sure everybody is kind of fighting for their own cause. And how do you kind of have everybody take a step back and really realize, okay, we're doing this, as a group.
Yeah, here's the social issue. We're all in this game together.
How do we all help?
Well, they have financial incentive, and that helped a big deal, right? And also, as I said, this was 2016, 2017, so we implemented it at the end of 2018. The whole healthcare community was now talking about the social determinants of health. Like, if you weren't playing that in that space, you were like so 1990s. So you had to so they're like, okay, fine. And because we had been talking about it for a really long time and it gotten these people together, so I'm like, we have to stop talking and start doing, because people around us are starting to do and we're looking silly, so we have to start doing. And this is what I said to them, because we have people who are doing social impact investing, right? So I was approached by somebody who knew somebody at somebody's like Ivy League wedding, and who said, oh, my friend's doing this. And so they said, here, we'll give you money. We have young entrepreneurs, young philanthropists who, unlike their parents, now want to see social impact for their money. They don't want to just keep giving their money to the same charity that their parents always gave, and they want to see social impact investing. So we'll call them Ivy League. So we Ivy League group, we get the money from young philanthropists, and then we get you all together, and then we convince the person who's going to benefit, also known as the hospitals, right? Because they'll see reduction in their unreimbursed healthcare costs for the use of the ER. And then we'll get them to pay the investors back with an ROI. Right. Well, that's a lot of money, and I'm like, and so we brought that to our group, and they're like, but we're all here already, and we already know. Yeah. We don't need them to amalgamate us. We're here. And I said, okay, then. So we want to do something. CMS was going to give money to do it. Who's going to get the money? I said to the healthcare providers, if you get the little money, I'll get the big money. I said with false bravado.
No, but she definitely did say that. Very convincing at the time.
And they're like, okay, what's the little money? And I said, the little money is to pay for the case management services.
Right.
And the big money is to pay for the housing. Well, thank God DCA came through, because I'm still trying to get private big money to help with this, because that's what I thought I would get. And I'm still working on that. So they're like, so you sort of say, okay, you're the little money. Well, then without mentioning names so much, the smaller hospital of the sort of two, I don't know if they're still competitive, but, historically competitive hospitals said yes. So then the person that we've been working with from the bigger hospital jumped up and down and said, oh my God, we have to say yes now. Right. So it was those sorts of pressures of playing, one off the other. And then we're in the middle of it. So hopefully we can tweak it so that we can show, because we absolutely have benefited their patients, our clients, and that must have some financial impact. It all depends on, there's damned lies and statistics, right? So it all depends on how you measure it.
But it's super interesting. I think, we probably won't get into it here, but one of the biggest, things we hear in the nonprofit world more and more and more is less cost-based funding. So a lot of agencies and funding, the state's doing this, they're converting to more fee-for-service model.
Mhm.
Everyone's moving away from a cost-based funding model. Like, we're going to pay you for salaries.
Mhm.
Instead, they say, we're going to pay you for impact. You prove to us that you served 3,000 people and we'll give you money. Not you're going to pay for these people's salaries.
Right.
And I think that it's definitely a shift in generational. Like, the millennial generation is a lot more, as you said, they want to be involved. The generation before us, like my grandma's little, like Mimi, she wants to write a check to you because it makes her feel good to write a check to you. She has the means to do it, and here's a check. Do your good.
Do I have her number?
What's that?
Do I have her number?
No, but I told you I'm seeing her at a wedding next week, and I'm gonna definitely ask her for a generous donation. But
Yes.
it's interesting. But that's a big part. The more and more we hear it, like maybe the younger folks of the new generation don't necessarily have the financial means to support organizations. But they definitely want to be involved in organizations. They want to volunteer more. And if they do have money, they want to give you money, and then they want to be they want to participate. They want to they don't want to just give you money.
Yeah.
And so us adapting to that and is interesting. I think we're all going to experience that in the next 10 years, is getting away from costs so much, even though obviously you have to run a business. So there are costs. You got to know what they are.
Well, we talked about for this pilot to do performance-based reimbursement, and I was like, but I can't hire people for 6 months at a time, right?
So think about hiring people without a budget.
Yeah.
Because you don't have a budget with all this. It's just you're going to get dollars to make an impact. That's very hard to manage.
So I at least I said, I'm hiring persons for 2 years. So I'm telling you, this is a 2-year position.
Sure.
So I said, I cannot hire somebody for 6 months. This is a pilot project. We need it to be for 2 years. And so we settled on that for that respect.
Right.
So the one other cool thing that we do, this other project we do, is we were tired of sitting around waiting for vouchers to house people. We started a program in 2013 to create housing. We said, we're not developers, but now we sort of are, so we, just like we did a single point of entry for a homeless person, we went around to affordable housing developers, social service providers, banks who wanted to get in and out at a high cost. But we did go out to them anyway, and municipalities, and said, how about a single point of entry for a homeless project? Right? Because we didn't want you building for money. We wanted you building for need that we can identify through our homeless management information system, right? So, we have been recognized by the federal government for having reached functional zero for veterans homelessness. New Jersey didn't have a lot of veterans to begin with and had fewer homeless vets. And so we were able to, when Obama, his waning years, said, I'm going to throw a boatload of money at this. And if you throw a boatload of money at something, you can probably have a lot of impact. And
money doesn't solve every issue, but it certainly solves issues.
It certainly does. Yes, and it did. And a lot of communities were able to end veterans homelessness, functionally end, which means you can identify a handful of people or 2 handfuls of people, and you're working with them, and some don't want help, do want help, so on and so forth. But it's not an issue anymore. But if there's still money there, and people would come in and one say, I'm going to build a $6 million apartment complex for homeless vets. Well, that's not helping Middlesex County and its homelessness problem. I actually even said to this municipality, we don't have that many homeless vets. And they said, we know, but we can import them from Pennsylvania and they'll still be vets. They probably still will be.
You're correct.
You're correct there. But that does not help.
But our charter is Middlesex County.
Yeah. So we
don't want to add to that.
So we wanted people building for need, not building for existence of money, and not building for ease of passage, because you have to fight the stigma around homelessness, and your town council might not want to approve a complex in your town, unless you do a lot of work. And it's easier to say it's for senior citizens or it's for veterans because that tugs at people's heartstrings, but we wanted you to build for need. So we started this program, and we actually have push-pull projects. So push projects, we go out and we try to find land or property that needs refurbishment. We created a downstream LLC. We had a cadre. We have a pool of affordable housing developers that said they answered our RFQ and said they want to work with us. And then we say, can we partner with you? And you got 85. We only have 15% stake, but we want to make sure it stays true to its mission. And you're the real developer. We've learned a lot from them, and we'll actually catalyze the construction of affordable housing. We also do pull projects, which is, you're not going to stop doing what you do just because we started this little Homes for Homeless program, but pull us in, please, because we'll help identify new money, and we'll also give you need data, that, you're not just, again, building for other things.
Yeah. And this is where I know from my just outsider looking in, Eileen obviously understands this way better than I ever will, just she's ingrained in it and basically created all of this. But, that this is also where our coordinated assessment comes into play, because not only are we building housing, but now we have a prioritized list of individuals that we know, like these 10 people, they're first in line to go to this. You don't have to go find them. You don't have to build the housing and find people. It's the bigger picture of, we know who all these individuals are and what their needs are.
Yeah.
And now it's, okay, we know how to create an impact. We have to now find people that are going to partner with us to build housing. And I think that's where I've seen just a really intelligent idea of going about it. It's not build the housing and place people.
Mm-hmm.
It's, we already know who the people are. Let's build the housing so we can start placing them. It's just a different thought process.
And it's even educating even institutional funders, because they're like, no, like you build housing and then you have this whole fair housing marketing plan. It's like, no. When it's for homeless people, the coordinated assessment system replaces the fair housing market.
We already have a waiting list. We already have the waiting list.
Right. And by its very nature is non-discriminatory, because it's just people who came to you who are homeless. It's not that
it's not discriminatory in the sense that it's based on need.
Right.
And that is not,
right.
We're not where it doesn't matter. There's nothing that goes into it other than these are the symptoms of this individual, and they need to get in here first.
Right. And so what we're trying to do for the people who are building and have some homeless component to their affordable housing complexes, you can have some criteria, because you've got a list of need and then you have a list of resources. And the list of resources, they can have some criteria, but it can't be too exclusionary. It's like, well, we don't want anybody, who's homeless. It can't be that. But it can be, we don't want anybody who's been a Megan Laws or is an arsonist, who's convicted of arson or something like that. So we asked to look, in order to get our recommendation for their funding proposal, that we make them sign in the memorandum of understanding. See, my legal background comes in handy.
Yeah.
To say, you'll use our coordinated assessment system and you'll let us look at your screening criteria of your tenant policy beforehand, so we can agree, so that on your needs and our needs, and come to some balance.
See, Eileen, you like legal compliance. You just don't always admit it.
I know. I like people complying to my rules.
That's what it is. Yeah. Eileen and I always go back and forth. I always talk about accounting compliance, like tax compliance and all this. Right. And she's like, I don't know what you're talking about.
Yeah.
But then every once in a while, she throws in this legal compliance thing, and I'm like, hey, see?
And we need to hire people to make sure you're in compliance. I'm like, what a waste of money. No.
Yeah. We don't need those providers. We have them. We have volunteers on our board. They're fine. They're going to make things happen.
Somebody will let us know if I've done something wrong.
Yeah, well, exactly. Yeah.
I always prefer to ask for forgiveness than permission. So.
Yeah. Well, that is how you get things done.
That is how you get
in all honesty, in any world, especially the government world.
Yeah.
Well, maybe not.
Yeah. Well, I used to say this, and this is true. If I was going to do some presentations, I'd say, ending homelessness. There are no rules. My husband would say, you can't say that. You're talking to a room of regulators. Right. And it's like, there are no rules, because you can think of to do different things. However, there are resources and there's funding and there are rules attached to that.
Yep.
And that's fair. If you're giving me money, you get to make the rules about how I use it.
Be creative.
Yeah, absolutely. And I get that. But, outside that.
Yeah. Well, that free thinking is how you got to where you are. That's how we got, that's how a lot of these programs came about, was that free thinking.
Yeah.
If you just followed the rules, how many nonprofit agencies would go work with a hospital, 10 social service agencies, a housing developer, and all these. And it's like, well, but look at the impact.
Yeah.
You think, that's what outsider looking in sees it. So super interesting.
Thank you.
But, so I guess, bigger picture. So we're a not-for-profit organization. How does one help our cause, right? And help the overriding cause of ending homelessness? Like, how can someone help Coming Home further our mission?
They can support our fundraisers, and they can just give donations. So you can give donations through our website, www.cominghomemiddlesex.org. I'm plagued with long names.
Fundraising side, we've been trying some really cool ideas. I think that's one of the things I've had fun with. We tried a golf outing 4 different ways.
Yeah,
we did regular golf course, fancy golf course, mini golf, top golf. We tried literally everything. And you really learn from that about what's profitable and what's not, going back towards the mission. Yeah. What's fun, what's not. And eventually you land on something that ultimately works. But a lot of trial and error. That's what I like about it.
Yeah, we've done 4 golf outings, true.
Yeah, all different types.
And 2 social events.
And some
so now
social
events. Come to the big one. Yeah. I mean, we did the race.
We did a friend raiser. Yeah. Friend raiser. That was interesting.
Raiser.
Yeah.
That was fun.
low-cost event that you just get a lot of people to build your network and, kind of get people to know who you are a little bit better.
And learn the Monmouth racetrack.
And learn how to gamble. That's
Sorry,
right.
we went out of county for that one.
Yeah.
Yes, but we don't have a racetrack.
That's okay. It's all in New Jersey. It's fine. We can fundraise.
It was fun.
So, all right. Well, yeah. Thank you so much, Eileen, for your time.
You're most
Obviously,
welcome. Thanks for having me.
Super appreciate having you on here. We look forward to continuing to do the great things we're doing.
Thank you. Thank you so much. Nice to meet you, Heather.
Hey, Warriors. Thanks for tuning in. On the next episode of Civic Warriors, we'll talk with John Natali from U.S. law enforcement organization LEO about raising awareness and providing assistance to those that serve our communities. Make sure to subscribe to Civic Warriors, and thanks for all your support. Have a great day.